good afternoon, good evening, or good morning, everyone, everywhere, depending on when and where you are watching us. We are so grateful that you are here with us today. Now, I'm in a different city today. So outside my door, it is a beautiful summer day here in the beautiful capital of New Jersey, Trenton. What's it looking like in your neighborhood? Today, we are going to talk about the skin and skincare. It is very important. It is vital. You cannot do without it. Skin is the largest organ on our body, yet it is the only organ in or on our body that does not have a muscle of its own. Therefore, it is necessary that we do things to keep our pores open, clean, and most importantly, sweat. I am Ambassador Prophetess Lisa Parks, and welcome to Africa Online Media Corporation. We are so glad that you are here with us today. So, I'm going to turn this part of the service over, this part of the program over. I'm still in church. I'm actually just getting out of church, so church is still on my mind. But we're going to turn this part over to our co-host for the editorial of the day, Professor Neosung. How are you, my brother? What's it looking like in your neighborhood down there?
Good, thank you. Just cloudy, and if a minutes ago, I mean a few minutes ago, there was some rain, but it's gone now, and the sun is shyly showing its face, and we're able to at least withstand the 90-degree heat that we have down here in Maryland. Good afternoon, greetings, and everybody, please welcome to the show. It is the eve of my dear one's birthday. July 28th is a date that we remember every year. July 28th is the birth of Madame Florence Asong-Lefrak. All right, that said, it is Sunday. It is the 27th day of July in the year 2025. It is the 208th day, that is, 208th day of the year 2025. That leaves us just 157 days in the year 2025. Can you imagine? Only 157 days left. Well, we will walk the walk. Today is the 30th Sunday of 2025, on the 31st week of 2025, using US calculations. This is the 38th day, Ambassador Lisa, of summer. That leaves us with 57 more days before we see another season. Today we celebrate World Day for Grandparents and the Elderly. As we celebrate, let us remember that our future depends a great deal on how grandparents and elderly and grandchildren together learn to live together. Grandparents and grandchildren, they live together even in different generations. Let us not forget that the elderly are also here with us to celebrate this day. And grandparents and the elderly are with us because they take care of their bodies. And as someone has said, we need to take care of our bodies because these bodies are the only house in which we live. They're the only home that we have and that we live in. Which brings us to today's topic, as you heard co-anchor Ambassador Lisa said, skincare is one of the priorities of today's topic. Ladies and gentlemen, in conformity, therefore, with our tradition at Africa Online Media Corporation, today we are treating a health topic. The body health, well, of course, if the body is not healthy, then nothing is healthy. That being said, it is the last Sunday in the month of July. And of course, we know that health is wealth, and that wealth should not be interfered with or legislated under any circumstances. Some experts tell us that, quote, the skin is the largest organ, you heard Ambassador Lisa say, in the human body, and that it protects us against germs, dirt, and harmful substances. This requires us to perform such habits, quote, like washing and applying lotion, end of quote, to make a big difference in our bodies and to ensure that our bodies are healthy. However, little is known scientifically about the benefits and the clinical efficacy of these practices of washing and applying lotion. What kind of lotion? Well, I hope the best that you can find. Notwithstanding, skincare routines in our homes, in our hospitals, and in medical facilities may not necessarily be based on any given evidence or specific practices, but rather on personal beliefs, preferences, and best practices. So, what are those healthy things we should know about and practice daily to ensure that this house of clay called the human body contains, or rather is regularly and adequately taken care of? That is where our health experts and all of us gathered here today will be doing, will be addressing, will be looking at and finding answers as we commit to raise awareness about our skin and the attention skincare requires and needs. But first, we already know that our guest is not a guest. She is part and parcel of the Africa Online Media Corporation team. She's of the Health Squad, Dr. B. Tazong-Fomundam. I was going to mispronounce it. Sorry, please. So, Ambassador Lisa, are you going to take over and have our main guest introduce herself?
I certainly shall. Thank you for that interesting editorial. We want to welcome at this time our guest speaker for today, our expert on skincare, none other than our own Dr. B. Tazong-Fomundam. And we are going to have a delightful talk about skincare. It's summertime. We've got the sun beaming down, and our skin always requires special care, but especially in the summertime. Welcome, Dr. B.
Thank you so much, Ambassador Lisa. Please, I'm going to apologize. I'm on the road, which is why I'm not on video. But I'm going to be as careful as can be. And I thank you always for giving me an opportunity to share the knowledge that can help all of us to stay healthy while we're on this earth. So I'm going to wait for you to ask the leading questions, and we'll go from there.
Okay, well, okay, here we go. As I said earlier, it's summertime, and I'm going to start with a very personal question. I was at the beach this summer, and I've never burnt before. I tan very nicely, but this time I ended up with a blister. I ended up with skin peeling, and I've never had that before. So why, as an African American, am I?
You're right. Go on.
I'm on the air. Why am I on at this time having these skin issues with the skin peeling and blistering? And I use suntan lotion too.
That is an amazing question, and I'm going to backtrack a little bit just to lay a foundation, and then I will answer your question, because that's a very important question that we're not talking about enough. And so you're absolutely right, Ambassador Lisa. The human body is the largest organ in the body. It basically is the only thing that separates you from the outside. If you didn't have a skin, then you really don't exist. And that's why the skin is so important, even though we take it for granted, because we get up every day, and for the most part, if you don't have skin issues, your skin functions just fine. So you get up every day, your skin is fine. You never get up one day and part of your skin is missing, unless you really have a particular health issue. So we just get up and we assume that our skin is always going to be there. But the skin, like every other organ in your body, needs proper care. And we need to understand it and treat it with the respect that is due to it. Because if your skin gets damaged, I call it the walls of your house. Again, because it's the only thing that protects you from the outside. If you damage the walls of your house, that house is completely unsafe. It's exposed. And that's why when people have wounds or when they get major burns, they have to isolate them, because they basically don't have a protective barrier anymore. So not only does your skin protect you, it does a lot of things. It helps to regulate your temperature. It helps to regulate a lot of other things that go on in your body. It absorbs stuff. That's why we can absorb chemicals through our skin. And so when you understand that, you start understanding how critically important it is to protect the skin. It's a lecture that I have with all my patients, black or white, whatever skin tone you are. Every skin is susceptible to damage. And so every skin must be jealously protected. I always say, because it is the only house you have You cannot swap it out. You cannot upgrade it. You cannot go and say, hey, I need a new skin. You can have this one and give me the other one. What you have is what you're going to have. It's going to have to hold you until the end. And I always tell people that if you do not protect your skin, you're going to have to drag it to the finish line. And I've seen that happen. And it's very sad to watch. And the other thing about the skin, unlike other health problems, is that the skin is there for everybody to see. When you have issues with your skin, it's a very obvious problem. It's not like high blood pressure where people may not really see your blood pressure. They may see a few things here and there, but they can't really see much. It's not like diabetes. It's not with cholesterol. You can see a few things here and there. But for the most part, when your skin is acting up or acting out, people can see and they can tell. And so it makes skin a very, very sensitive topic because it's a disease that you carry on you. It's visible. And so when people talk about skin, we have to be very mindful because their disease is very obvious to most people. So, Ambassador Lisa, what I'm going to talk about too now, I'm going to answer your question and then I'm going to go back and regroup. So my background is originally, again, lifestyle medicine, preventive medicine, but I was blessed with an opportunity to start practicing dermatology in the last few years, and it's been such an amazing experience. I've learned so much, I have come to understand so much, and I'm grateful that we're beginning to have this conversation, and I know we'll have better and more intense conversations down the road. So every skin burns. I'll tell you guys a story. When I first came to this country, I never knew anything about sunburns. I came here about 30 years ago. I used to live in Los Angeles, California, and I'm going to go again and say something more personal. I went to school in Santa Monica College when I first got here. And I remember one day I was on campus walking between classes and it was quite hot. And so I just remember thinking to myself, it's a really hot day, but I didn't think about anything else. I didn't think about anything else. So I didn't even know that there was such a thing as getting a sunburn. And I'm pretty dark skin tone, as you can tell, what we call a skin type 6. And so when I got home that day, I just remember my skin burning all night. My point is that every skin burns. There's no skin that is safe from sun damage. Now, when you are darker skin, meaning that you have more melanin in your skin and the structure of the epidermis is a little bit different, you're less likely to have skin cancer. But anybody can have skin cancer, but more especially, everybody can have sunburn. And sunburn is basically damage to the skin. I'm also going to make an unfortunate point here. Any kind of suntan is damage to the skin. A tan is the body's response to sun damage. It's the body trying to defend itself from the damaging rays of the UV light. So anytime somebody gets a suntan, I always remind them, you just sustain some skin damage. There's no safe tan unless you're doing a spray tan. Tanning beds, no use. So if ever you're tanning, just tell yourself, I am actively damaging my skin and I'm going to pay for it down the road. So if we're talking about skin type, again, if you're fairer skin or if you're lighter skin, let's say from the type 1, which is people that have little to no melanin, they probably never even tan, they just burn when they go out, all the way to skin type 6, you can't sustain a sunburn. Again, melanin helps somewhat, but when there are different parts of the UV ray, there's the UVA and UVB, and then there's a visible light. So the UVA, the way you can remember it is A causes aging, B causes burning. So the most important and most common cause of early aging is sun damage. So for people who are trying to look good and trying to hold on to their skin tone very nicely, you want to avoid sunburns. It doesn't matter what your skin tone is, because the UVA rays, when they hit your skin, they damage the connective tissue in your skin. The connective tissue is made up of collagen and elastin. That is what keeps your skin nice and tight. And that's why when people have sustained enough damage for a long time, you see their skin becomes very loose, it becomes very thin, they bruise very easily, and they call it old age. It's not because of old age, it's because of sun damage. Your skin has gotten thin, you don't have a lot of firmness to your tissue, including the blood vessels in the skin. So the slightest thing, some people, if you just grab them the wrong way, you see them, they turn black and blue, or they have that bruising, and it's because of damage to the skin. Some people may have inherited versions, but for the most part, it's caused by sun damage, and we call it actinic purpura. So actinic has to do with the sun, and then purpura is that darkening of the skin, the bruising from the sun damage. And then when you have sun damage, we call it actinic skin damage. Now, the UVB rays are the things that cause the sunburn. And those are the things that in darker skin, it may cause sun tanning and darkening of the skin. but as the skin gets fairer, it also causes it's a precursor to a lot of skin cancers. Because what happens is that when the sun is hitting the skin tries to protect itself. So it tries to put out a little bit more melanin. Melanin is basically like a guard. Melanin is a natural suntan in your body. So it stands guard and it blocks the UV rays from damaging your DNA in your skin. So the lighter you are, the less melanin you have, the more damage your DNA sustains. The problem is that for most people, they don't see the damage until decades later. So we have patients that used to be out in the sun. They'll tell you, I was a sun worshiper. We know it already. Your skin tells us. Your skin collects all the evidence and we can see it and we can tell. So maybe 30, 40, 50, 60 years later, that's when you start noticing the damage. And you now say, oh, what's happening to me? Even the actinic purpura, what's going on? Well, this is from years of sun damage and consistent damage to the skin, either from the burning or from the destruction of the connective tissue. And then over time, which of course is because you're getting older, the damage becomes, it compounds, and then you start seeing all those symptoms. So a lot of our older patients, they'll come in and they say, I have not been in the sun in the last 10 or 15 years. I said, I know. Most people sustain their damage when they're younger, in their late teens, early 20s, because that's when we're really crazy. You know, human beings just don't act right when they're young. They think they're invincible. It's a human problem. And so as we get older, the effects of the sun damage begin to play out. So for example, the skin cancer starts showing up because your body has tried to repair the damaged DNA, or it's happened so much over time that your body just could not do it. And then those cells become mutated and they start producing skin cancers, and there are different kinds. The two most common ones from sun damage are basal cell cancers and squamous cell cancers. And then we also have things like melanomas. There are other kinds of skin cancers, but the two most common ones, of course, basal and squamous. And so if we have to talk about the skin, we need to remember that. So that's why it's important to protect the skin. Another caveat that I always like to put out there is that animals understand nature better than we do, because we humans, we are pretty smart. And I'm going to go back and say, because we're made in the image of God. And so sometimes we abuse that knowledge and that wisdom, and we misuse it, or the knowledge, because wisdom is basically proper use of knowledge. So we misuse the knowledge and the level of thinking that we have. So we think we can just go and sit in the sun. If you ever visit a zoo in the middle of a hot day, you will not see animals. Most animals out there, they have fur, but they're hiding from the sun. They go under the shade. They go under drinking water, but if you look in their little shades, you see them hiding. And so I always say, animals that have fur understand the power of the sun. How come we humans that don't even have fur don't get it? Because we're too smart for our own good. All right, I'm gonna let the conversation continue. Hopefully, I've laid a reasonable groundwork for us to move forward from there.
Wonderful, thank you, Dr. B. We
Yes,
will at this time. Go ahead, Nia-san.
Yes, Dr. B, you bring my attention to this particular aspect of protecting our skins. Our Black ladies tend to put on creams and whatever to tan themselves and change their colors from the black that you and I know to something else. How dangerous is this to these, our women who do this to themselves? Some men do it too, anyway.
So you're absolutely right. I think, fundamentally, it's difficult to have this conversation without talking about race and all those things, because why don't you love your skin? I always tell my patients, again, black and white, because we need to start learning to love ourselves. Everybody, black people, white people, we need to start loving ourselves. You did not make your skin. You did not determine your skin color. In fact, you had no say in that conversation. And so to me, that's always a comforting thing. I always say, God gave me what it is that He wanted to give me, and I'm going to learn to love it and to take care of it. Why do people tan? They want to get darker. Why do people bleach? They want to get lighter. Nobody's happy with what they have. So maybe we just have to learn to be happy with what we have. People tan because they want to, I mean, if you ask my patients, they say they want to look darker. And some of them tell me, I want your skin. I'm like, you don't need my skin. If God wanted you to have the skin type, He would have given it to you. And then black people are bleaching because they want to have the lighter skin. And I'm like, if God wanted you to have lighter skin, He would have given you lighter skin. But again, that takes people getting to that place where they understand that they are not in control of everything. So yes, bleaching is not good because you're basically damaging your skin. You're damaging the cells in the skin. And the other unfortunate thing is that the melanin actually serves a major protective factor in your skin. So when you're damaging that, that means now that you're also becoming more and more susceptible to other kinds of sun damage that are protected, that you're protected from when you have more melanin. So I think the big part of the conversation is you need to love yourself. You did not make yourself, but you're good enough the way you are. You need to start telling yourself that I am wonderful the way I am. I am not supposed to be like the next person, and the next person is not supposed to be like me. I am unique. There's only one person just like me in this world, and the way I am is perfect. And then the other thing is realizing that those things are not just chemicals that are damaging the things in your skin, but they're also doing a lot of other things. You'll notice a lot of people that do the bleaching, they have issues with, again, actinic purpura as they get older. That's basically damaging the connective tissue in the skin. And so when they get older, their skin breaks more easily. Their skin cannot handle stressful situations very well. They bruise more easily. I've taken care of Black people who have had those problems, and I'm speaking from that standpoint. So I think that we really need to think about it. But everybody has what they so strongly desire in life, and no matter how bad or how good something is, some people will just never engage. But at least they know.
Thank you for that. I was also going to ask about other things that may happen to the skin if we don't maintain it. What are some of the things to do to make sure that you keep your body in the shape you came into the world with, or that you have aged into?
We have to protect our skin from the sun. That's one of the first things. It doesn't mean you need a little bit of sunshine. You need sunshine because, one, it's therapeutic mentally. We use it to treat a lot of mental health issues, especially things like depression. There's some illnesses on the skin that get better too with the sun, but you don't need too much sunshine, because then you cross the line of just getting enough to help you to becoming basically destructive for your skin. So we need some sunshine to help us with the skin. You need it for production of vitamin D, because there's a reaction that happens when the sun hits your skin. It basically drives a reaction that produces vitamin D, which is a very important vitamin for your body. And so, but you don't need too much. So the most important things, again, sun protection. So for example, we need to avoid sun exposure during the times when the sun is at its worst, the UV ray is at its worst. If you read a sunscreen, it tells you between 10 and 2, but when you read the dermatology textbooks, it says 9 to 4. And again, it actually depends on where you are, because there are some places that stay hotter for longer. We need to be mindful of the UV index. And a lot of times they warn us, like, today there's a high UV index. That means that the UV rays are very aggressive. Again, with the damage to the ozone layer, we have more aggressive UV penetration into the earth. And so if you get that warning, you should understand that you're more susceptible to sun damage on such days. So you want to go out earlier in the day before the sun really comes out and gets really hot. And that's when you also get some of your vitamin D. Or you want to go out later in the evening when the sun is kind of dying down. That way you're avoiding the damaging rays of the sun. Another thing is applying sunscreen. Once upon a time, again, because we were not aware how much the sun damages every skin type, but now we know the sun damages every skin type. So sunscreen is important for everybody, whether you're Black or white. Now, the thing about sunscreen, once upon a time, because they didn't know that Black people needed it, they didn't really make it for our skin type. So people would put it on and they'll have this white cast. The good news is that most companies now are looking and working hard at producing sunscreens that are good for every skin tone and every skin type. So when you're looking for a sunscreen, you want to get something that is broad spectrum, that covers at least the UVA and UVB. And now we're even talking more about tinted with things like zinc, because they're also finding that, especially during COVID, they did a lot of studies and they realized that even visible light in the visible spectrum actually damages the skin too. And it's harder on Black skin than white skin. So using some things that are tinted would help with that, things like with zinc and titanium and so on. So you want to use those. And then for people with sensitive skin, you want to use less of the chemical sunscreens and more of the ones that are made out of zinc and titanium and all those things. Those ones are less likely to cause you to have a reaction to your skin. And then, so you're looking at the types of the sunscreen. So broad spectrum, preferably tinted. The other important thing about sunscreen is that you need to use it properly. I don't care how good the sunscreen is. If you're not using it properly, you're not using sunscreen. It's almost like saying that I have a bulletproof vest and it's sitting on my chair and I'm not putting it on. Well, if a bullet comes through, guess what? Your bulletproof vest is not going to help you because it's not on. So everybody, I encourage, even in the clinic, I encourage my patients, please read your stuff. When you read your sunscreen package, it tells you that sun is damaging, is a primary cause of early aging and skin cancer. And it says in order to protect your skin, all these things, avoid unnecessary sun exposure, avoid sun exposure between 10 and 2. Again, it's 9 to 4 actually. And it tells you apply sunscreen. So the way to apply, you put on sunscreen, follow the instructions in the package, but remember, sunscreen is only good for 2 hours. I don't care what kind of sunscreen it is you use, because the way sunscreen works is that it captures the UV rays from the sun. And in the process, it disintegrates. And they found that after 2 hours, your sunscreen is no longer, basically, you no longer have sunscreen coverage, which is why I think a lot of people get in trouble with sunscreen because they think, oh, I put on my sunscreen, why am I burning? You probably sat out there longer and you didn't reapply. Number two, if you're swimming or sweating or jogging, anything that causes you to get drenched, guess what happens? The sunscreen basically gets washed off your skin, unless they say it's waterproof. And if they tell you it's waterproof, they tell you how good it's covered. You're covered. Some of them will tell you 90 minutes or so and so minutes. So you know after those number of minutes, you no longer have sunscreen coverage. If you're just using regular sunscreen, when you get in the water, you swim, you sweat, or you're sitting out there, you must reapply every 2 hours. Otherwise, you no longer have coverage. Another thing we recommend, because the sun doesn't just damage the skin, it also damages the eyes. That's why a lot of farmers get macular degeneration. You want to wear your sunscreen, your sunshades, especially the ones that have UV protection, polarized, and so on. That's important when you're out and about in the sun. You want to wear a wide brimmed hat. What does a wide brimmed hat does? It's almost like a little umbrella over your body because it covers. So if you're wearing just a face cap, just the front part of the cap is covering your face, is covering your skin. But a wide brimmed hat it covers around your head, so it kind of provides a little shade around your whole head area. So that's important. Another thing that is out there now, which is really also good for protecting your skin, is the SPF. SPF is sun protection factor. They have a lot of SPF shirts and things like that now. So if you're going to the beach, and they're pretty nice, they're not very hot, you can put them on, and basically they block the sun from hitting your skin directly. So anything that you can do to reduce the amount of sun that is touching your skin, except for a very determined amount of time to get maybe a vitamin D, you want to do it. And then just don't be out there in the sun unnecessarily. You may like the sun, but your skin does not like the sun like that. I hope I answered that question for you, sir.
You did, but I also have a question because we're talking about wearing sunscreen and so on out here, yes. But down there in the tropics, in Africa, for example, what does the person on the street do? They don't have any of those things. How do they know that they're being skin burnt or whatever?
So, you know, a lot of those people are very wise. They found a way to cope with life. For example, if you notice, like a lot of those mothers who used to go to the farm, they went out early morning. By the time the sun came up, they were done farming back home. And then when it gets really hot, what do? They sit under the shade. And then a lot of times they wore their little long sleeve things too, because not only does it protect you from the sun, it protects you from maybe things that can bite you or scratch you. So you wear nice long sleeve, breathable cotton things. If you go to the desert, people don't, you know, a lot of those people, they wear all those wraps and stuff, and they're not really hot because you wear nice, breathable stuff that reflects the sun. So that helps you too. So there are things that you can do. Again, number one, just don't be hanging out in the sun like that. Your skin doesn't care for that. But you can just wear nice, breathable clothing. Wear long sleeve shirts and long pants to cover the skin so that the sun is not directly hitting. Those things directly interfere with the sun's ability to damage your skin.
Ambassador Lisa?
Yes.
Your turn to ask more questions. I think
I have a question that's in the chat box, but before we go on to that question, I want to welcome Dr. Gloria Crossland, one of our regular contributors. If she's there, we'd like her to mute, say hello, and ask a question of Dr. B if she has one.
Sure. I want to thank Her Excellency Ambassador Reverend Dr. Pam for having this platform that gives me an opportunity to listen, learn, and apply what I learn. And so I will be applying, Dr. B, I will be applying sunscreen. And my question, and thank you, Ambassador Lisa and Professor Neilson, and to all the other listeners. My question, Dr. B, is about the legs and the back. I do know there was a girl complaining that she had to go to the emergency room because she got skin burn more than just on her face. I think she was on a cruise, white girl. And yeah, I think her back also got burned and all of that. So we do have to apply sunscreen all over, and obviously we can't reach our back. So usually people will help us out with that. Um, And that's the first part of my question or comment or observation. So my real question is though, how can we tighten our skin? Is there any such cream that will tighten skin?
So, ma'am, that's a very good question. And I'm going to give you an answer that may not make you very excited. The most important thing to tighten your skin is to avoid sun damage, because that's what makes your skin loose and lax. Now, if you're not doing that enough, then there are things that people say work, but we don't have enough data yet. Some people say it does, and some people say it doesn't. And so you can do it as long as you're not harming yourself. Give it a try. So a lot of people use things like collagen and elastin, and then sometimes vitamin C. Those things help. But the bigger thing is stop the damage. If you stop the damage, you don't have as much of a need for those things, but they still come in handy. There are things that you do with your skin that help. Part of it is genetics, but part of it is really protecting your skin from the sun, because that's the biggest culprit.
Thank you. Dr. Claus, Dr. B,
Yes,
there's a
ma'am.
question in the chat box about acne.
Yes, ma'am.
Can you kind of weigh in on acne, the cause of it, and how it affects the skin?
Yes, ma'am. So I saw the question, but I didn't want to keep going back and forth. So I was like, let's finish one thing and then move on to the next one. So I'm not sure if we're done with the other one yet, but we can always come back to it if necessary. Acne is it's caused by a bunch of different things that are happening to your skin. Some of the three most common causes at this time, it's one, a dysfunction in how your pores clear out fat in the skin, which is called the sebaceous glands. And then another one is that if you have any kind of blockage in those glands, it allows the fat in the skin to build up. And when it builds up, we all have fat in our skin. But in those pores, normally your pores should clear them out. But in those pores, sometimes it's a buildup of a lot of fatty material, and it provides an excellent environment for this bacteria that causes acne to grow. And then sometimes the hormones too. Hormones can cause your body to produce a lot more, a disruption in how your body produces fat in the skin, and also how it clears it out. And so that can also contribute to development of acne. So basically anything that is multifactorial, and when we're treating, we're going from each of those angles. Sometimes you're going for the hormones, sometimes you're going for the clearing the pores, and then of course getting rid of the bacteria, because when you have that buildup and the bacteria grows, then you have acne, and sometimes it comes with some inflammation too. So when we're talking about acne, we're trying to address all of those things. And then as far as clogging the pores, there are many other things that people use. There are a lot of products that people use on their skin that clog their pores, and they don't even realize it. Sometimes it's hair products, sometimes it's skin products, different things. And then sometimes it's just not exfoliating your skin properly. And over time, you may have a buildup of fat in the sebaceous glands, and they're not properly cleared out. And again, they provide an excellent environment for overgrowth of the bacteria that causes acne.
Thank you, Dr. B. I was looking online as we were preparing for this show, and I noticed that we have 3 layers. Hello?
Yes, ma'am.
Oh, I thought I froze out.
Hello? Hello?
Dr. B, I don't know what happened to Ambassador Lisa or Tazong, but they are coming back in.
Okay, Reverend Pam.
Yeah, I posted a couple of questions in the chat box. If you want to read it and respond to them, please.
Okay, Reverend Pam. Let me take a look out. I'll get to the moment.
I'm so sorry. I don't know if you're hearing me, but I've had a power outage. So that's what is going on here. Power outage.
Did you guys have a storm?
No, the outside has been darkening gradually, so it's getting darker every second. Are you getting me?
Yeah, Ambassador Lisa is having connectivity. So
Yeah.
I put a couple of questions in the chat box. So Dr. B, do you see them?
I don't think it's connected either.
Dr. B, kindly unmute yourself.
Yeah, he's muted. He's muted. She's muted rather.
Dr. B, kindly unmute yourself.
Okay,
Yeah, she just
I was looking at those questions, but the questions didn't come through. It was just the comment on what we talked about, but I didn't see your questions.
You didn't see my questions on the chat?
No, I didn't see them.
the power outage, I don't have them either.
Oh, Lord. Okay, let me read. Well, let me just pose the question. Wait a minute. I said, kindly weigh in on acne and facial hair.
Okay.
All right, let me mute.
All right. So I don't know if we lost the conversation on acne. Facial hair too, a lot of times, part of it could be genetic, but the other part could also be hormonal. And for a lot of women, they have other things going on. When you have that excessive facial hair, we try to find out if there's any kind of hormonal disturbance and treat it. But there are also things that can be done to treat the facial hair, especially when you can't find an underlying cause. Then now you just have to go for that destruction of the hair, the roots of the hair. And there are many things. I don't have all the information on all the newer modalities, but there's laser treatment, and it's not a one-time thing. It's a course of treatment over months, because they keep trying to destroy the root of the hair, so the hair follicle and the root of the hair follicle. So if they can, so they have to hit it at different times, and hopefully hit it at a time when they can completely damage the root of the hair so that it doesn't grow again. But that's always a challenge, because a lot of the lasers don't work very well on black skin. They tend to cause discoloration. But a lot of times when they cause discoloration, a few weeks later the skin heals and it comes and your body regenerates the skin color. So it's a short-term problem for most people, but it's still, annoying when your skin has like all these different colors and almost looks like you have some vitiligo. So I think that's just a very basic thing. There are many things that could be driving facial hair or excessive hair growth. Again, hormonal things can be part of it. Part of it could be genetic, and there are many ways to take care of it.
That said, I had this question before the power outage.
Thank you, Dr. B.
Yeah. Had this question before the power outage. Wrinkles. How do wrinkles come about? Is it necessarily age? Is it a concern?
So wrinkles, part of it is aging, but part of it is the sun, which is what we talked about before.
Okay, I must have been cut off, so I was not really following. Yeah.
Yes, part of it is aging, part of it is the sun. So let me try to explain. Yeah. Aging in the sense that, as you get older, it's a wear and tear thing. Your skin changes. It becomes, the muscles become a little bit looser and so on. But the sun accelerates that process. The sun, also chronic inflammation has a lot to do with it. The chronic inflammation, like what you're eating, not getting enough. And that's why the way you treat your body does matter, because eventually it's going to show up in how your skin behaves. If you have high blood sugars, those things tend to damage your skin. If you become overweight, it tends to damage your skin because it causes the skin to stretch more, and it's like a balloon. When you blow it out and you let it go, it doesn't go back to its original shape. So there are many little things that can feed into the process of wrinkling. So yes, there are things that happen as you get older, just because the muscles are over time, they have had a lot of wear and tear. They don't return to their original shape as they used to, but the sun doesn't help the situation.
Now, doctor, eating right, that is diet, and of course, sleeping well, how do those contribute to keeping the body as good as it can be?
So you remember when we started talking about the skin, we said it's the largest organ in the body?
Yes.
The way you eat affects your heart. It affects everything in your body, and that includes your skin, because your skin is an organ of the body. So the things that you eat can either help promote good health, feed your skin well, or they can help destroy your skin. So foods that are rich in antioxidants, a lot of the things we use on our skin, they're antioxidants. They are things like collagens and all those things. These are things that you can actually get from food. So if you're eating a nice balanced meal with the different colors of the rainbow, there are foods that you eat that help to brighten your skin, like things that are rich in vitamin C, things that are rich in beta carotenes and so on. You can actually, there are people that sometimes they come in and we think, hey, does this person have liver cirrhosis? When in fact, what they're doing is they're eating a lot of beta carotenes. Those things that have a lot of the carrots and all those those colors in the food and tomatoes and so on, it can actually change your skin tone. Now, are we suggesting that people should eat that to change their skin tone? No, but if you're eating a balanced meal, meaning you're not overdoing any one, but you're eating all the different colors of the rainbow, you're drinking enough water, you're basically feeding your skin right. And what is your skin going to do? It's going to respond by thanking you and staying healthy. And then if you're eating a lot of pro-inflammatory foods, again, those are foods that are heavily processed, they drive inflammation, which causes damage to your skin. And one of the things that we do when we're treating skin is we're trying to get rid of advanced glycation products. So that's basically sugar attaching itself to your skin, to the cells in the skin and damaging them. Another thing that happens when, again, you're not eating well, you're more likely to gain weight. And for some people, you can see damage to the skin in the form of acanthosis nigricans, where you have that velvety thickness on your skin, or sometimes a lot of the skin tags. And you see a lot of those on people that are not eating well or that are overweight. And a lot of times patients come in, they want you to fix it. And I say, well, even if you try to fix it, it's going to be a failure because it's an ongoing process from something that is happening to your body. And what you need to do is correct that process by taking better care of your body, working on your weight. And then we do know that there are a lot of problems with the skin that get worse with obesity. Things like hidradenitis, which is basically people that have a lot of boils and so on, abscesses in certain parts of the body, like the armpits, underneath the breast, in the groin area. Those things, they tend to get worse as people gain more weight. Same thing with things like psoriasis. A lot of your patients will tell you the symptoms seem to get worse as they gain weight. Symptoms also, things like psoriasis and so on, the symptoms get worse when people are stressed out, even acne. So, and remember, we had talked about lifestyle before, the 6 pillars. It's nutrition, it's exercise, it's proper rest, it's stress management, avoiding risky substances, things like smoking and alcohol. All of those things affect your skin. And so the way you treat your body is going to also be reflected on your skin.
The way you treat your body is also going to reflect on your skin. That being said,
that's right.
Now, Doctor, back on the continent of Africa, where we have a good audience, what should we be telling them on a daily basis about watching out for some of these ill effects of too much sunlight or not taking care of our bodies in the first place?
I'm sure a lot of the patients already know it. A lot of our guests already know it. A lot of our audience already know it because they start seeing funny things happening to their skin. Like your skin, you start having discoloration. Some parts are darkening, especially from sun damage, and they're trying, some people bleach because they're trying to correct that, but some people bleach because they want to change their skin tone. That's different. So I don't care what you do. If you don't correct the underlying problem, you can't correct the problem. And that's why every time we talk, especially about like skin discoloration, the first most important thing we tell patients is protecting your skin from the sun. If you protect your skin from the sun, you're less likely to have discoloration issues. And if you have discoloration issues and we're treating them, it's only going to work if you protect your skin from the sun.
And we come now to talk about bathing. Are you bathing with cold water or with warm water or with hot water? Which is better?
So it depends, right? Hot water,
You broke up.
But hot water literally strips the skin. It dries it out. And so people that have sensitive skin, people that have things like eczema, one of the most important things we tell them is you cannot take hot showers. Or not, you cannot. You can if you want to, but you should not take hot showers. Because things like eczema, there's a, we call it a skin barrier dysfunction. They tend to have dry skin. And when they take hot showers, it may feel good for a moment, but after that, your skin just gets dry and more itchy. So that's an example. And then the other thing about hot water is that it helps to dilate the pores in your skin. So if you're trying to minimize how much things are being absorbed into your skin, you don't want to use very hot water because when the water is hot, I mean, your body knows the pores dilate. So they are more open to receiving stuff.
Ambassador Lisa?
Yes.
Yeah, go ahead, please. Oh, Doctor.
Yes, I did have, before I got kicked out, I was asking a question about the degree of burns, first, second, and third.
Yes,
and most of the time when people are burnt to the 3rd degree, or they have 3rd-degree burns, since we have 3 layers of skin, that means they've burnt down to almost to the muscle and the bone. And sometimes they have to do a skin graft. How does the skin graft protect the skin when it's still missing that second and mostly that third layer of skin?
Wait, can you ask the question again? I missed a part of it. How does the skin graft do what?
How does the skin graft protect when you're burnt down to the third? You have third-degree burns. That means your skin is burnt through 1, 2, and 3 layers. And sometimes they have to do skin grafts. How does the skin graft work to protect the other layers? Does the other layers regenerate themselves, or exactly what's going on with the skin there?
So like you said, it depends on how much skin is damaged and what part of the body and so on. And what the skin graft does again, when your skin graft grows, it basically starts behaving like the skin in that area. So it starts behaving like the way normal skin should behave. So if it goes all the way to the muscle, you can't just graft skin alone. You have to do skin and muscle. So you have to replace what has been lost, right? And so when you replace it and it grows and it feeds into the rest of the skin and it becomes part of that skin, then it just does what the skin does. Although a lot of times you can always tell because it's a little different because they took it from another part of your body. So they try to take skin grafts from parts of the body that look very similar, especially on the face. They try to collect skin from other places where the skin looks most alike so that the transition is very minimal. But otherwise, once they've grafted the layers of the skin that have been damaged, then you just have to let the skin heal. The body is amazing. God made our body so amazing. They're able to regenerate and grow if we give them a chance.
If you give them a chance, but the human being we know is very heady. Sometimes they don't listen to you. So what should the medical people or those in communication do to ensure that they keep the people out there informed and educated about how to take care of their skins?
So I'm happy you brought that up, sir, because we are all human beings. We don't always do what we're supposed to do. And sometimes we do what we're supposed to do and then we get tired. And then sometimes people find themselves in situations where they're not in a mental or emotional state to do the right thing. And so I think a part of practicing medicine is being compassionate, being empathetic, and realizing that people are at different places in life, and just giving them the information they need and the encouragement, and always letting them know that it's really under your control. I can help you, but I cannot control the narrative. It's on your control. The ball is in your court, but I'm here to help and support you when you need me or if you need me. And otherwise, it's really up to you. And it depends on the outcomes you want. I always tell my patients, the only person that is with you all the time is you. You know, I'm here. You see me every so often. I'm here to help you. I'm here to give you expert support. But it is your duty to follow through. If you don't follow through, you're only going to get as good as outcome as the work you put in. They always say, don't be annoyed by the result you get for the work that you did not put in, right? So I think helping patients realize that it is within their power and their purview to do better, and letting them know that I am not responsible for the outcome that you did not do, the work that you did not do. It helps them to recalibrate their minds and also manage their expectations. Patients, if you don't do your work, that's fine. I'm not mad at you. It's your body. You have a right to not treat yourself well if you don't want to, but don't expect things to go well for you. And I think that's what I try to impress upon my patients. Again, be compassionate and be kind, but also let them know this is really something that only you can do. I always tell my patients, the only time somebody was responsible for you was when you were a child and your mother or your father had to feed you. After that, you had to do everything. So you are responsible for what you're doing to your body.
Dr. B,
yes, ma'am.
There was a time when I was using coconut oil. I was trying not to use chemicals and things on my body, and I was always of this mind, if you can eat it, then you can use it on your skin. And I was preparing to go to Africa, and it was literally the week of leaving, and ended up the day before I was to take flight with my face so swollen that I had to go see the dermatologist. And he explained to me that coconut oil is too heavy to use in the summertime. It's good for the winter for your skin, but not good in the summer, because what it did was clogged up my pores. And now I had this really bad infection and I had to get this special medication. It was like $75 copay with the insurance. So when we're trying to keep our skin moisturized, we're trying to stay away from the chemicals, and we're trying to do that which is natural. How can we know I guess, how can we know when is the best time to use which best products, or which products we could use in which seasons?
Okay, ma'am, that's a good question. Because this is a conversation I have with my patients too. When the seasons change, your body behaves differently, and you have to be mindful of that. And so, I'm so sorry. I'm a Christian, and I always think about how God arranged everything. There's a time and a season for everything. There's a time for heavy oils and heavy moisturizing, and there's a time for light oils and light moisturizing. So, what happens during the summer? During the summer, it's more humid. Your body holds on to more. You hardly see people with dry skin during the summer because it's just a little bit hotter. Your body holds on to more moisture. It holds on to more. It's more. You have more. Your skin is more moisturized, so you don't need a lot of heavy stuff because your skin is already in a good place. But as the seasons change, what happens during the winter? You have less humidity in the air, so the skin tends to be drier. And people that have sensitive skin, things tend to get really crazy as the weather changes, especially going from spring or from summer to winter. They start experiencing a lot of dryness, a lot of itching, and so on. And so, what I recommend, especially with that, is that during the summer times or when it's more humid, or if you're in a more humid climate, you want to use lighter oils. Does that mean they should not be nice quality? No, use nice quality but lighter oils. But when the winter comes, or times when the skin is really dry, for example, when I travel, my skin tends to dry out because when you fly, what happens? You're in the plane. There's not a lot of humidity in the plane. The air, the AC, and so on. I generally don't have dry skin on my face, but when I fly and I get to where I'm going, I find my skin is just really dry, and so I know that I need to moisturize a little bit better. And you want to use nice moisturizers, things that have things like hyaluronic acid in it, ceramides, and so on. They help with moisturizing. So I think that's the best way to think about it. Look at the season, look at how your skin behaves, and then go from there and say, okay, if it's more dry, especially in the winters, I'm gonna need better quality moisturizing. If it's in the summer when it's not as dry, there's more humidity, my body's holding on to more moisture, then I don't need heavy stuff. Unless, of course, there's something really going on with your skin, and then you go with what is happening to your skin at that point in time.
So, in keeping with that same theme, and we're almost at the top of the hour, I believe Dr. B can answer this question very quickly. So, when you go into the stores and the store has creams, body lotions, and then body creams, one is light. If I'm understanding from what you just said, the lotions would be the lighter ones, while the creams would be the heavier ones, and creams we should be using in winter.
And again, it depends on your skin situation, right? So yes, creams are light, lotions are lighter, creams are heavier, ointments are even heavier, and your skin absorbs them a little bit differently too. So yes, during the winter, more of my patients, especially when people are not excited about having too much moisture in their skin or too much lotion in their skin, like use a lotion, use something that is lighter but also still good quality, that has all the things you need in it. And then as the weather changes, you want to go to the heavier stuff. Yes, ma'am.
Thank you. That was very good, because there was a time when I didn't know the difference between lotions and creams. Like, why do we, other than the fact that lotions you can easily pour out of the bottle, while creams you kind of have to scoop it out or you have to squeeze it out of the tube. But I didn't know that there should be a change in the way you moisturize and in the way you moisturize your body between the seasons. All I know is I was using coconut oil, unrefined, extra virgin all winter. It was giving me no problems until I got ready to leave for Africa. And I usually go like right around May. And my face was swollen. I had to get special medication to go because I had the oils, or the coconut oil. It just in my mind, the doctor did not tell me this, but in my mind, putting that coconut oil meant that it was solidifying in my pores and causing my pores not to breathe, and therefore end up with this infection.
Yes, ma'am. I think one thing that I want to qualify to is that nobody has to do anything. And I think that even goes with the freedom that God gives us, but it's the wiser thing to do, because some people say, well, why do I have to do this? And why do I have to get two different kinds of oils for my skin? You don't have to do anything that you don't want to do. You just have to live with the consequences, And so these are just really kind recommendations to help your skin along and to get the best quality for what you're trying to accomplish. because I don't want anybody to walk away thinking, oh, the doctor said you must do this and you must. No, you do not have to. But if you're trying to accomplish certain goals, these are really good ways to accomplish them. So apply wisdom and also tell yourself, I'm going to work with the seasons. It's almost like saying, hey, if you want to go out in the middle of summer and wear the heavy winter coat, that's up to you. I'm not going to tell you not to do it. It's not in your best interest. So people should, I think people, they do better when you present it to them as an option, as opposed to saying you have to do this and you have to do that. Because nobody has to do anything, not even the right thing. You don't have to do it. You just have to take the consequences.
Thank you, Dr. B.
Yes,
Dr. Gloria, we're almost at the top of the hour. Do you have a comment or question that you would like to add or ask?
Sure. I think it's an excellent topic, and the doctor's very knowledgeable, and not all doctors are knowledgeable, so that's great. I guess my question is, again, to piggyback off of the creams, and do they really work for, I know they work for moisturizing because, it's easy to put water on something and voila, it's moisturized instantly. But to get a little bit deeper uh, into the skin, to like change the structure of a wrinkle, is that possible? Or once a wrinkle?
Oh yes. They have a lot of products right now. Unfortunately, I'm on the road. I cannot pull them up for you and just share them. But they have a lot of nice products that help. Some of them get a little bit pricey, but also just this whole thing about just treating your body well, your body knows how to behave when you treat it well. So the first thing again is, I'm going to be honest. I never had acne before, and then in the last few years, my body started acting crazy. I know part of it may be a little bit of stress here and there, but part of it too is just, I think it's hormonal, me going through. I'm a woman of a certain age. Things are beginning to change. My body is screaming about it. But what I've noticed is that when I eat properly, I don't break out as much. When I rest, even the days that my skin is acting up, when I get enough rest, I get on my skin is so much better. When you drink enough water, you're basically giving your body the tools that it needs to take better care of itself. So yes, there are things that you can do about the wrinkles, but also just taking good care of your body, managing your stress. Your body knows when it's stressed out. Cortisol causes you to age faster because it actively damages the things in your skin too. So all of those things add up. Smiling more helps. It helps the muscles. You notice some people have such a scowl, then you'll see one, they'll have a line on their face that doesn't go away. But that also, part of it is genetic, but part of it is really what you're doing. But there are also things that can help. There are a lot of products that I recommend to my patients that help them with wrinkles. We have one of them that is a little bit on the pricey side, but it helps. And when I say pricey, how much people pay whatever they want for what they want. I've seen people pay certain kinds of money for certain things. I'm like, wow. So it depends on what their priorities are. If they say, I hate this wrinkle so much, or I'm in showbiz, or I'm in this kind of, and I need my skin to look a certain way, and on this, for me, this is an investment, and they're willing to do it, fine. Because some people spend their money buying an expensive dress or an expensive pair of shoes. Some people decide, I'm going to do good skincare. So it's really about priorities, but there are good products out there. And over time, we can pick one topic at a time, and I can make some recommendations, especially when I'm not on the road moving. I can pull up some stuff and we just go through them, and I'll say, hey, these are some of the things that you can use to help your skin along, and you're going to get good outcomes. And I've tried them on a lot of people. One thing that is simple that also helps. For example, again, I don't particularly want to endorse any one company, but there are companies that produce nice stuff, and I've recommended it to a lot of people, and they love it. For example, La Roche-Posay, right? They have an anti-aging set. It consists of vitamin C, hyaluronic acid, and retinol. Retinol is really good for aging. So that's something what you asked me. Retinol is really, really good for aging because it helps to it speeds up the cycle of the skin. And you will notice people that start using it early, let's say like in their 40s. You see some women that are in their 80s and they look like they're in their 50s. I bet you they're using retinol. I mean, some people are using other things too, but retinol is really good for the skin, like the anti-aging. So if you put that along with things like hyaluronic acid, because as we get older, hyaluronic acid is basically a moisturizing factor in the skin. But as everybody gets older, your skin loses its ability to hold on to moisture that well. So hyaluronic acid it basically plumps your skin up. And you'll see when you use it for a little bit, even a lot of the wrinkles, it's almost like somebody just moisturized the skin and the skin just became fresher. It looks younger. It doesn't look as wrinkled. So those are things that you can use. And then vitamin C, it helps to brighten. We call it brighten and tighten the skin. So if you use a regimen like that, you're going to see good outcomes. But the catch too is that not only should you be taking better care of yourself, but you should also use it consistently, because especially with skin stuff, if you're not consistent, you're not going to get the results you want. I joke about it with my patients. I say, if you're an athlete and you say you want to be an Olympic level athlete, but you're just doing, half-hearted exercise, people don't want to get to the top. The people that want to be the GOAT, they go above and beyond. So same thing with your skin. You have to be committed to your regimen and do it and stick with it. Usually we say stick with it for at least 12 to 16 weeks, because a lot of people, you will see the changes during that time frame. And then over time, it just becomes cumulative.
Thank you, Dr. B.
Yes,
12 to 16 weeks is the time that she is suggesting that we should use our skincare products or do our regimen, because it takes that amount of time to see results. You're not going to see results overnight. So while we chew on that and we think about that, we're going to move on to our anthem. We're going to play our anthem. We're going to encourage you to take that 5-minute break to stretch your legs, go to the bathroom, check on your dinner, get a drink of water, and we'll be right back with our next week's topic, our commercial, and we will continue this conversation. In the meantime, it is now time for our anthem.
Oh, Africa. Oh, no. Africans, Africans for Africa. 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 Africans have many bright ideas. If only you let us share. If you really want to know my history, please come, sit down, listen to my story. God gave us a wisdom. He guides our footsteps, makes us shine and transform. Hey, as one people, with so many cultures, yet indeed we are one. Stand up, Africans, let's save Africa. Let us all unite behind AfricaOnline Media Corporation. Stand up, Africans, let's save Africa. It's time to come together, promote awareness, progress, and solution. Hey. Africans, Africans for Africa. Africans, Africans for Africa. Africans, Africans for Africa. All Africans can rally for a common cause, to believe without judgment in what our brother does. To identify and resolve our challenges, to allow each other's ideas without regard to standards. As one people with so many cultures, yes indeed we are one. Stand up, Africans, for Africa. Let us solve all the problems plaguing our continent. Stand up, Africans, let's save Africa. Let us empower Africans in and out of Africa. Stand up, Africans, for Africa. AfricaOnline Media Corporation, that's a good way to start. Stand up, Africans, let's save Africa. They have all the resources we need to benefit our society. Oh. There will be education for everyone if we believe. Prosperity for Africans if we believe. Medical facilitation for Africans if we believe. Stand up, Africa, yes, for Africa. Africa Online Media Corporation, that's a good way to start. Stand up, Africans, let's save Africa. Africa is the cradle of civilization, the motherland. Stand up, Africans, for Africa. We were enslaved not because we were weak, but because of our hospitality. Stand up, Africans, let's save Africa. Jump on the Africa Online Miracle Jet. Don't be left behind. Stand up, Africans, for Africa. Together we shall succeed. Together we will win. Stand up, Africans, let's save Africa. We are writing our own story, the truth, and we shall tell it to the world. Stand up, Africans, for Africa. No more lies, Africans own Africa.
No more lies. Africans own Africa. At this time, let me stop going on over here. Nia-san, do you have a topic for next week?
Well, next week happens to be a new month, August, and it is the month in which we're planning to do the STEM. So we intend to do our discussion, focus our discussion next month on STEM. The STEM education is very important, and it's something to be highlighted, it's something to be talked about as regularly as we can. So next week is going to, from next week for 5 weeks or for 4 weeks, is going to be STEM. Then after that,
yes,
of course, we shall end the month with a health topic. So STEM.
Science, technology, engineering, and mathematics.
That's right.
That is our STEM. There are so many acronyms. There's STEM, and there's STREAM, and there's STEW, which is one that we have coined ourselves. But
yes, so
thank you so much for next week's. Well, next week, not this next week, but next month's topic.
Next month.
And while we are on the subject of announcements, Africa's Brain Bank, which is AfricaOnline's sister organization, will be having its 6th annual summit. And we will be in the city that never sleeps, New York City, from September the 4th, I believe it is, to the 8th. Let me grab that date, look real quickly, because I thought I had it in my head.
No, August 28th to September the 1st, Labor Day weekend.
Oh, August 28th.
Yes, to September the 1st, Labor Day weekend. Ambassador Lisa, says Labor Day weekend, August the 28th.
I have it on my calendar as something different. Okay, August 28th through the 1st.
Mm-hmm.
That's getting ready to be a problem. But anyway, we invite you to come and take part in the 6th annual summit. It is going to be a power-packed weekend. There's going to be the businessmen's lunch. There's the billionaires breakfast. There is Saturday summits. There's panelists. Our very own guest speaker today, Dr. B, will be one of the panelists for Saturday's summit. Then Saturday evening will be the red carpet gala where there will be awards. Our co-host, Professor Nia-san, will be one of the awardees, and lots of other things to do. So we want you to go ahead on over to the africasbrainbank.org and get your ticket. You will find that you don't have to come for the whole weekend. We prefer you to, but there is something for everybody, and there is something that you can participate in. The deadline for getting your tickets, I believe, is the end of this month. I was thinking it was the end of August for September, but I believe it's the end of this month to register and get your ticket, your hotel room at a discount price. So go ahead on over to africasbrainbank.org Let me just make sure that is correct. I think I spelled it wrong, but I believe it's Africa's with an S, brainbank.org, and see what is going on for the 6th annual gala and come and join us in the city that never sleeps. Back to you, Nuya-san. I think that's my computer.
Want to continue with the discussion, or is there any other announcement?
Well, you know, after the top of the hour, and we have a little bit of time left, I'd like to talk about some of the things that we can do. We've talked about the skin and what it is. Let's talk about some of the things outside of sunscreen and sun tanning lotions. Dr. B has already said it's best not to damage the skin at all. And as we said earlier, the skin is the largest organ on our body. And I stated that it's the only organ that does not have its own muscle. So it does not perspire, it does not sweat necessarily on its own. And for those of us who are mostly sedentary, we're not doing so much activities that cause us to sweat on a regular basis. We don't want our pores getting clogged up and our lymph nodes being clogged up. So Dr. B, one of the things I do that I've been doing for the last 4 or 5 years is dry brush massages and lymphatic massages. You want to talk about some of that and how that is beneficial to keeping our skin from becoming damaged?
She's muted. Dr. B, please unmute and let's continue the conversation.
Dr. B, we do know that she is traveling.
Yeah.
She is on the road, so she is.
Please give me a quick moment. I'll join in. Let me just get.
Okay, no problem.
Thanks.
So, as I was saying, that some of the things that you can do to keep your skin from being damaged is lymphatic massages and dry brush massages. It is very important that we give that skin an opportunity to breathe. Now, we do know that skin is a protective. As we said earlier, it protects, it regulates our temperature, it keeps us from germs and bacteria. So if our skin is keeping those things from affecting our organs, just imagine what it's doing when we eat meat, that chicken or that pork or whatever it is that you enjoy to eat, and you're eating that skin that is there to protect that animal from diseases and germs. And I personally don't eat skin. I may eat a chicken wing. You can't peel the skin off of that, but I don't eat skin as a whole. I don't eat it on chicken. Anything I buy is boneless and skinless. So we might want to consider that because, as Dr. B said, it takes a regular appetite. A regular balanced meal to be healthy. So we may want to take some of that into consideration when you're eating skin from an animal. Dr. B is still look like she has unmuted.
Yes, ma'am. I think if I had to be very, very extreme.
If you have to be very what?
If I had to be extreme,
okay.
I would say the real deal is that we are really not supposed to be eating animal protein. That's the truth.
That's
but
true.
Now the thing is that is not practical for most people. And so if you're doing most of the right things, your body will respond in kind. So as long as you're not eating these things all the time and you're loading up again, if you're behaving well with your fruits and your veggies, your whole grains, so eating a lot more whole food plant-based nutrition, you're eating a lot more some nuts and seeds. You don't want to do too much nuts and seeds. Nuts and seeds are very good for your body, but the problem with nuts and seeds is that they're also oily. So they are very rich in a lot of good things, but they're oily. So for people that tend to break out, you don't want too much of that. But if you can just focus on eating a lot more whole food plant-based nutrition, if you do a lot more whole food plant-based nutrition, you're putting your body in a better place to overcome the stresses of life. You know, the antioxidants, the phytonutrients, you only get them in plants.
Mm-hmm.
And that's because when you go out, I always encourage people to engage with nature because you just learn a lot. When you go out in nature and you look at the plants, those plants have to survive the environment. Because when the plant is growing, everything wants a piece of it. You know, the insects, the animals, everything is trying to get something from the plants because everybody's trying to eat. And so those plants have to defend themselves from the elements. And in so doing, they build a lot of survival tools. And those are the things that we call phytonutrients, antioxidants, and so on. So if you're loading up on those, eating a little bit of the other things here and there is not going to kill you. If you really want it to be perfect, the goal is whole food, plant-based. Like, everybody should really be eating, we should be avoiding animal protein.
So
that's not going to happen. So, but
yes,
the less
I'm sorry,
animal protein you get, the less animal protein and the better the quality. So more of the lean ones, less of the ones that have been infused with chemicals and so on, you're still in a better place.
So less dead animal flesh and more plant-based will be very vital to good skin care. Now, before you were able to unmute, I was asking you to explain a little bit about the benefits of dry brush massages and lymphatic massages, which I do on a very regular basis.
So my take on it is that I don't have enough information to say whether or not it works. And I always also say, you know, growing up in West Africa, there are a lot of things that work. We just don't have enough information that supports or counters them. And so I say, as long as it's working and it's not hurting you, by all means, please do what you need to do. I know a lot of things that they did growing up that worked well, but we don't have enough research to back it up and say this is it. And so I think that's one of my sore points for us, especially Africans. We need to commit more to research so that we can support the things we do, because that's the only way you really get a voice. You can't tell people, hey, do this and do that, when you can't give them, for example, a dosing and an amount and so on, where you don't have standardized care. And that's usually the biggest problem. So I'd say if it's working and it's not hurting you or harming you, and it's not causing you any pain or discomfort or distress, then I have nothing to say against it.
Okay. So, in case you did not understand what she said, because I think you were cutting out a little bit on my side. I'm not sure if you were cutting out for everyone else. Nia Sung, were you able to hear her clearly?
Yes, there were some cuts here and there, but not
okay.
Yes.
Okay, what she was saying.
Ask the question all the same, yeah.
Yes, what she was saying is that she did not have enough information, and that we as a people need to invest more in research to making sure that some of the things that we're doing actually working. I know that dry brush massages and lymphatic massages work for me because I'm not sedentary, but I'm not doing enough activity for me to sweat on a very regular basis. I'm not going to the gym, and I'm not overworking myself in the gym to cause my body to do that natural sweating. So therefore, my pores are not being exercised by perspiring. So, but dry brush massages, you want a natural bristle brush, and you want to do things like make sure you open your lymph nodes under your arm and then your groin and then your neck. And you want to do circular rubbing, just very gently, because your skin is that first layer is very delicate. You just want to do just little circular rubbing on your skin with that brush, just to get your body, that skin to circulate, so that it can begin to move that sweat, opening your sweat glands and opening your pores so that sweat can come out. I know when I first started doing dry brush massages, I think I was sweating for like 15 minutes afterwards. I couldn't even go out. Even after a shower, you were still sweating. But I was just getting my body used to getting that muscle, that skin muscle, to open up and be able to move on a regular basis. Nia Sung, it's 5:20. Are we going to continue our conversation or start the round of the table? Or do you
Yes,
have another thought?
Hello?
Yes.
Yes, I just wanted to say something because you made a point.
Sure.
I wanted to bring that up. So, you know, as Professor Lisa said, the skin is it's very sensitive. You have to treat it kindly. The body is amazing. It knows how to defend itself from all attacks. And so when you're rubbing on your skin, like you said, you have to do it gently, because if your body perceives that it's being attacked, what does it do? It thickens up. And that's when we have a lot of, calluses and so on. So you don't want to rub your skin in a way that it gets irritated and thickens up, because when it thickens, then we have to start dealing with the thickness of the skin, unnatural thickness in that part. The reason why your palms and the soles of your feet are thicker is because those parts of the bodies are meant to handle a lot more stress. So you will notice if there's a part of your skin that you're always picking on or scratching, it's more likely to become thickened and discolored. So yes, when you're doing all of these massages, you want to be gentle because you don't want to rough the skin off enough that it thinks that it is being attacked and it needs to defend or protect itself.
Yes, that is very. When you were talking about calluses and treating the skin improperly, when we wear shoes that are sometimes too tight, or you wear sneakers that don't breathe, sometimes I know as a kid, we always had we always had cheap sneakers. You know, they were just cheap. We wasn't spending $100 on sneakers and things like that. And we always ended up with calluses and bunions and sores from where that sneaker was not breathing and it was not expanding. So our feet are very important. That's a skin that really needs to be taken care of. One, because not only is this the only skin we get, it is the only skin that we get. We can have organ transplants. You can't have a skin. Well, yes, you can have a skin transplant. That's what grafting is. But we can't shed this whole skin. We're not snakes, and then a whole another one grows back. So we must be very careful, as Dr. B said, with the skin that is on, especially on our feet. The kind of shoe that you wear, even the sandal that you wear, can cause our feet to build up an unnatural thickness. I've got some unnatural thickness going on in my feet too. When she said that, it just made me think about, well, what kind of sandal have you been wearing? Are you wearing something with good support? And my feet is now building up these calluses to protect itself. So now I have to be very careful about what I put on my feet so it's not building up that extra thickened skin. Nia-san.
Yeah, that being said, Dr. B, we know that you are on the road, so we are wrapping up now, but you'll be the last to give your last word. Just be preparing. So Dr. Crossley, are you still with us? Please give us, yeah, I always like to start with you to give us.
Sure.
Yeah.
Sure. Interesting, in a positive way. For me, it really opened my eyes to the perspective of the doctor. And, because as patients, we just want these quick fixes and quick answers and just to zap and make everything okay and like magical. And what I learned from her is to be nice to the body and be happy with it and take very good care of it and enjoy it. And what I learned from Ambassador Lisa is pretty much the same thing. Take care of the body and I'm assuming that's what Reverend Pam is doing, taking care of her body. I know she said that she was hanging in there. So, and it's always wonderful seeing you, Professor Nia-san, and you asked some really good questions, and you were the voice for us today, sir. So thanks a lot. And those are my words for today.
Thank you so very much, Dr. Crossley. It's a pleasure, always a pleasure. And Ambassador Lisa, I think it's your turn to give your last word.
It is my turn, and I think I've already said my last words when I said it is very important to take care of your skin. It is the only one that you get. Be kind to it, be loving to it, protect it. Talk to it just like you talk to the plants. Tell your hand how lovely your hand is and your skin how lovely it is. I believe it hears just as well, and it needs to be encouraged as well. So, in addition, we encourage you to join Africa Online TV every Sunday from 4 to 5:30 p.m. Eastern Standard Time, where we discuss a plethora of topics that benefit the African on the continent and those of us in the diaspora. We look forward to seeing you again next week. In the meantime, visit our YouTube page and our Facebook page, like and subscribe, and join us every Sunday for a wonderful conversation and topic. Back to you, Nia-san.
Thank you very much, Koanko. And we turn now to our main guest of the day, Dr. B. Tazong. Please unmute and let's have your last word as we wrap up the show on this 27th day of July. Dr. B, over to you.
Yes, sir. I just want to say thank you again. I think that knowledge is amazing. Knowledge is power, but it's only powerful if you put it to use. So The reason why I will always commit to showing up here and having a conversation is because I want to make sure that we have enough knowledge so that we can make better choices. And it's always a privilege and a pleasure to be able to help people make better choices, to help them see how they have control of their health and their lives. And as we're talking about the skin today, it's amazing to let people know that they do have the power to control their health outcomes. They have the power to treat their bodies well. And that is completely up to you to take the information you've had and run with it, and to be proactive. Don't wait for things to fall apart before you get help. Don't wait for things to fall apart before you ask questions. You know, it's important to be proactive and do the things that need to be done. Ignoring problems does not make them go away. They actually get worse. And by the time you're ready to fix them, it becomes a nightmare. And that's true with everything, including your skin. So just take good care of your skin. Your skin is going to thank you for it. Your skin is going to reciprocate the kind of care that you give to it. Thank you so much, and God bless you.
Thank you so much, Dr. B. And we look forward to seeing you in the month of August, because it's going to be STEM. You are a science-based student or person. So please come in any of the 4 Sundays and give us your view on any of the topics in STEM: science, technology, energy, and mathematics. So please, that will be the topic next week. Thank you all for coming. Please, it's a pleasure. We're sorry for the power outage we had momentarily, but luckily things got right back, and we look forward to seeing you next Sunday. Bye, and welcome to a new month next week.
Thank you.